We are recording now, and this audio recording will be broadcast and electronically manipulated by vertical internet radio. And is that something that you give us permission to do with this audio file?
Yes, I do.
Great. Hello and welcome to Health Professional Radio. I'm your host here on this Health Suppliers segment. Thanks so much for joining us here today. Our guest in studio is Mr. Mark Hollis, CEO of MacPractice. Welcome to Health Professional Radio, Mark.
Thank you.
Thank you. Well, you're a software security and healthcare technology expert. Tell us a little bit about yourself and MacPractice.
Well, Neal, I've been working with doctors in their offices for about 30 years. I used to have about 650 practices that I consulted with in the New York metropolitan area, and I did that for about 25 years. And then I co-founded MacPractice with Patrick Klein, who he and I are equal partners in our privately held company. We have about 30,000 users in 4,000 practices throughout the U.S. and in about 30 countries.
So when you say you've got that many users, so is this is a totally online platform, or is it a combination of online and maybe a little consulting at a physical location?
Well, our software is a client-server application. Okay. So every one of our clients has a server in either their only office, if they're a practitioner that has a single location, or in some instances, about 300 to 400 practices of ours have multiple locations that are connected via the internet or by some other means. Now,
I was talking about your being here to discuss encryption and how that plays an important role in a healthcare organization's success. Well, for those, most of our listeners are healthcare professionals, but for those of us that maybe don't know, explain what encryption is.
Encryption is the application of an algorithm to data that changes the data so that it requires an encryption key in order to be able to decipher the data in order to be able to read it. And would you like me to tell you a little bit about the stages of encryption that are actually important in a medical practice, or actually any kind of
especially since we are discussing medical practices in particular, that would be beneficial.
Right. So let me talk to you about in relationship to HIPAA's regulation. The HIPAA security rule that became effective in 2013 requires encryption of data at rest. Now, data at rest means when the practice is actually logged out of the software, so that the software is static and the data is actually encrypted. Now, that's both on the server, whether the server is local or the server is remotely hosted, and that's also data that might be on backups. So every form of that data is actually encrypted, and that's data at rest. Then data in motion is when the data is moving across the network, whether the network is inside the office and we've got a terminal that's connected to a server that's in the office, or whether it's from outside the office and it's connected to that location, or whether it's a cloud solution and it needs to encrypt the data between the browser, which is typically used in a cloud installation, and the hosting database, wherever that might be. So that's data at rest and then data in motion. And then there's two other additional things that are important in terms of HIPAA in regard to encryption, and that is the encryption of the database password. So a hacker can actually hack the database password if it's not encrypted. So they can come in and get access to your data even if your data were encrypted. If they have the password, as you have the password, then they would be able to get into your data even if your data were encrypted. So HIPAA requires that the database password be unique, meaning it's not hard-coded. It's not the same password in everybody's system from that developer. It's a unique password to that practice, to that doctor's office, and it's also encrypted. And then the other encryption element is encryption of messaging, or we call it secure messaging. I think it's easier for some people to understand it as secure email. So basically, it has to be encrypted at rest, meaning that you're creating an email. Think of it as when you use a mail client. And everybody can understand that. You're using a mail client, you're creating an email. It needs to be encrypted at that stage. It needs to be encrypted as it is sent, as it's in transit between providers, for example. So if it has electronic protected health information, which is the patient, any identifying information of the patient, and some information that is considered clinical. And electronic protected health information might not be logical. Some people might realize, well, they might think, well, that means I'm sending my clinical notes. No, it might be that you're actually sending a statement, because the statement has codes on it and tells the reader of that statement what procedures are actually done for that patient. Or if you're sending a prescription, or if you're sending, you could be sending advice as to actually registering, telling the patient how to register. It could be any information that you're sending that patient that has a combination of some identifying information, some unique identifier for them and their clinical information. And so that also has to be secure according to the HIPAA security guidelines.
So it's a huge undertaking and quite a bit of different types of data. It would seem to be even more complicated than financial data, and we all hear about the efforts that are in place and that are being sold to us to protect our financial data from identity theft and hackers, as we're talking about. Why do you think that the healthcare industry has become a particular target and the focus of MacPractice?
So you actually ask a couple of questions, one of which I'd like to comment on. You're absolutely right that it is very challenging and it's very daunting for a doctor's office in private practice to be able to actually have all of their data encrypted. Mm-hmm. So in regard to that, I'll touch on that for a second, and then maybe if you'd like, I'll come back to that, and then I'll talk about the value of it. Why is it that healthcare data commands a premium mm-hmm. for hackers, and why are they going after that data? Right. So the first thing in regards to the encryption of the data, the software vendor that develops the practice management and electronic health record software, that vendor can actually build the encryption into their software, or they can leave it up to the doctor to have to hire IT people at their own expense to try to protect the data. So if it's built into the software, it becomes a lot easier. So, and in addition to that, one other element is if everything that we just talked about, all the electronic protected health information and the services like sending secure messaging is done from within the software, so that there's no data that needs to actually be outside the practice management software, because much simpler, because even though there might be 10, 15, 25, or 100 computers in a large clinical practice being able to access the data, none of them actually have that data present on their computer. Only one computer, which is the server, has it. And if the software itself encrypts it, it's an all-in-one software. It's got integrated fax. It's got e-prescribe is built within it. Secure messaging is built within it. Integrated network word processing is built within it. So everything is there in that one place. Then only one computer really needs to be protected and managed and monitored by the HIPAA security officer. So to answer the other question, the primary driving motive for hackers, in my opinion, to go after healthcare data, there's a couple of primary motives. So number one, it seems to be easier to get healthcare data than it is to get bank data. Not that they can't get banking data, because we know they've gotten it and that they will continue to get it. Mm-hmm. But the healthcare organizations not seem to be as well protected. Even the large organizations, such as hospital organizations with large IT departments, seem unable to protect the patient's data in the system. So it's easier. That's what it seems to be. And then secondly, it commands a higher premium. So there's a monetary incentive. So if they're selling personal identification information without healthcare information, it may cost. They may be able to sell it. I'm going to say, for example, maybe for $25 a person. But if they have healthcare data, it might command twice that fee of $50 per individual. Mm-hmm. And the reason for that is because it can be used in a lot of different ways. So if they have the identification information, for example, of an American citizen, and then they also have their insurance information, then they can file false Medicaid claims and false other insurance claims, and they can actually receive benefits from them. They can go in, if they have their Social Security number, which they may have as a result of having this combination of all this information, they can go and get their Social Security checks. If they have banking information because they placed charges and the system did not encrypt that information, and they actually got the credit card information, they can go to the bank account or the credit card and do false charges. And all of these things are, if you look at it from the hacker's point of view, they have the ability to be able to capitalize. Now, the hacker's not capitalizing. Generally, the hacker is capturing the information and selling it at a premium to somebody else who then is going to use it in order to be able to take financial advantage. And you could just imagine recently, I don't know if you mind my telling you, but of the effect on patients potentially, but just imagine that one of your relatives, for example, was going to one of 145 cancer clinics in the Southeast United States, and you were to find out that their identity and health information was compromised and exposed, and they were a cancer center, which means they were very likely receiving life-sustaining treatment. Mm-hmm. And they ran the risk of not being able to make their home payments, not being able to, if the Medicare was fraudulently billed by a hacker or by a criminal, then they might not be able to actually continue to receive care.
Wow, that's
it's a big thing,
that's
and that actually did
situation.
happen. And in that case, actually, the FBI came in and forced this group of 145 healthcare cancer clinics to report.
Wow. Now, where can our listeners go and get information about MacPractice?
So our software website is MacPractice.com, mm-hmm. and if they register at MacPractice.com, we're a little different. I take a little bit different approach. We are a website where we feel that kind of like Sims. I don't know if you remember an educate consumer is our best customer. So we put a lot of information actually on our site. Unlike a lot of other companies, a lot of cloud-based solutions, we have actual people in the field. So we have a group of about 40 representatives throughout the United States, nearly in virtually every region of the United States that are available to do on-site presentations, but beyond that, they're all capable of doing on-site training and implementation, which is what's necessary to actually implement a system successfully in a doctor's office.
What's the one thing that you'd like to say to a healthcare provider or an organization when it comes to enhancing their encryption efforts?
Well, we talked about this. We talked about this earlier before getting on the call. There was a recent study that and I'm just going to take one kind of malware, and that uses encryption called ransomware. And I'm assuming that perhaps the people that are on the call have heard of ransomware. They know somebody else that may have had ransomware. Very likely, if they're on Windows, if they're on Mac, they may not have heard of ransomware because, as a matter of fact, there were 1.5 million reported incidents of ransomware over a period in 2015, all of 2015, and up to April 15th. 1.5 million incidents in Windows, and there was one incident in Mac OS in March of 2016. And unlike the Windows events, Apple actually addressed the vulnerability in the Apple operating system within a matter of a couple of days. Mm-hmm. And the software, which was a software called Transmission, was very different than the way that it occurs in Windows because it was actually programmers, not doctors, that actually went to a website called BitTorrent. They downloaded Transmission. They had this infected software, and it was discovered and removed within about 8 hours. Everything that's happening in Windows is the same kind of software, ransomware software, that is actually encrypting data and then holding it ransom. An example, I don't know if there's actually a hospital organization in Tennessee that didn't get their data up and running for 20 days. So if you could imagine what effect that may have had on patients whose data was held hostage for 20 days while the hospital tried to get access to it in order to be able to treat them. I mean, that's devastating.
Absolutely, absolutely.
Well, we've done everything we can to make it as simple as possible because doctors have what they already have is complicated. We've minimized their on-site IT by building it into our application to provide them the assurance that they don't have to spend additional thousands of dollars in IT. Most of our clients spend no more than a few $100s even with a 10 or 15 station system in their practice, they only spend maybe a few $100s a year at most for on-site support. And we tried to make this very easy. The one thing that doctors may want to remember is that while HIPAA requires them to have encryption, it does not require the vendor to build encryption into their software, and it does not require their vendor to reveal to them, unless they ask, whether or not they build encryption into their software. So it's really the doctor who's responsible to have it, but it's not the vendor's responsibility to have it. If a doctor has a malware event or has ransomware, and their data has possibly been exposed and possibly stolen by a hacker to be resold, the data has to be reported to HHS, and it's put up on HHS's website, and there's no way to be able to get it ever removed. There's no method for getting it removed at this point, so it will be there virtually forever. Wow. They have to send a letter, a first-class letter, to all of their patients and others affected. That might be the referring doctors, could be the hospital. In addition to that, they also have to put a notice on the home page of their website for 90 days, and they have to have an 800 number for patients to call. And as if that's not bad enough, they also have to report this breach to prominent media. So. Uh-huh.
So I did not know.
It's really devastating. It's devastating. Now, if they have their data encrypted at rest, in motion, and they have an encrypted database password, and they fulfill HIPAA's requirements, that these are the minimal requirements that HIPAA has for security. So if they have this encryption built in for all of these things, then they get a buy. They qualify for safe harbor, and they do not have to report.
Okay, so an added benefit of encrypting properly.
Absolutely.
Encrypting. Yeah, great. Well, that's excellent information. Good to know. It's been a pleasure talking with you here, Mark.
Well, thank you. It's been my pleasure.
Thank you.
To share some information about MacPractice, and I appreciate the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment of the show. In studio with Mr. Mark Hollis, CEO of MacPractice. He's a software security and healthcare technology expert, and he's been discussing what healthcare organizations should know about encryption and how encryption plays such a vital role in their organization's HIPAA success as well as patient outcomes. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.